Okay, so this is a dog with a squamous cell carcinoma of the lip. You can see the lip squamous cell carcinoma around here. It's adherent to the mandible here, so we're going to do a little segmental mandibulectomy to get this out with appropriate margins. So we just need 1 centimetre margins around this. Maybe if we just get a towel clamp and put it up there. These are kind of the lateral margins that we're going to need. We're going to go full thickness, and then we should be able to just close primarily, but in between we're going to take that segment of mandible out. And can I get a photo, please? I'm not sure where the battery position's at, but hopefully they're charged. Great, so just kind of like that. That's good. Perfect, thank you. Okay, so we're just going to do a full thickness incision through here. And then along here. Oh, I forgot I was going to get the mandibular node first.
These are the radiographs that you were looking at earlier?
What's that?
Was this the patient whose radiographs you were looking at earlier?
Yes, yeah. She had a questionable lung met that we followed for about 4 weeks, and there was no change, and
Right.
then we got that evaluated, and they didn't think it was a met. They thought it was something else. I forget what now, but
It was a granuloma, no?
what's that?
Was it, I think it was a granuloma possibly?
I don't think it was a granuloma. It's
Or
something
maybe
else.
the other ones were, the static ones were granulomas?
Anyway, so they said go ahead. Can you ask for another pair of mayos, please? Actually, you can take a photo too. I have another pair of mayos. Thanks.
Same to you?
Yeah. Thanks. Thank you. So,
We just got the, we touched the,
so I'm just coming full thickness through here. I'm going to come down onto the mandible here. So I don't need to take out much mandible, just where it's very close to the mandible's basically for margins. The mandible itself is not involved. wonder if I can even do a rim. I might get fancy. Can you hit the button again? Yeah. Shorten things a bit. Can I have a? Can you grab me like a TP-low saw blades? So say 27. I need to go kind of shallow, I think. Because I think we've got enough of the cortex there that we can preserve.
Okay.
So I'm thinking about a rim mandibulectomy here.
Yeah.
Because the cortex we can preserve, and that means we won't need to plate afterwards, and it'll be a lot simpler.
Okay.
So we'll just see what we can do here. The smaller ones will be kind of too, the arc will be too deep. So I think if I
24s or 27s?
Just open 24 initially. This will be a bit of trial and error, so I apologise in advance.
Okay.
So that actually might work pretty well. Maybe a bit too long. Can I have a look at the 21?
A bit too long, Ross, for them?
One in quarterly.
Okay.
We just need to come up through there quarterly. God, those teeth are awful. Maybe I just have to go through those and take the teeth out. And maybe a job for
Any other advantages to doing this technique over the segmental mandibulectomy?
just preserving. So instead of using a plate and foreign material and everything else, particularly with teeth like that.
Yeah.
And then if you can grab Graham, can you see if Graham can? I'm hoping if I do this, he'll be able to take out the teeth and I don't have to. So that'll give me pretty good margins. I think the 21's good. Can I grab another photo?
Very cool.
Just take a photo in there. when you see the exclamation mark, it didn't focus.
Move the frame. Okay.
That's good. Great, thanks. Have a TP low saw, please. The TP low saw.
Did she not give it to you?
I saw blades, but I was just testing first.
Are these some special type of screws?
I don't know.
Locking plugs, and the other ones are.
Oh no, so locking plugs are for the string of pearls.
Okay.
So when you bend them, you don't distort the holes.
Oh, I see. I don't know if I've seen this one too.
Thanks.
A little road circle.
Okay.
Sorry.
There's one more thing for me to take out.
Sorry.
Thanks. Okay. I'll give the rest to you. Thank you. Thank you again. You said the 21. Is this, oh, that's the 21. Okay. So if you can just hold the jaw just there, just to provide some counter traction as I do this. Hey man. Just let me do this quickly and I'll talk to you.
Are you doing a dorsal marginal, like a rim, or?
I'm doing a rim, but it's just for a lip squame, so I'm just getting, and it's adhered to the,
Okay.
so it's just for margins.
Yeah.
But I'm just wondering whether you or Matt can help me, well, not help me. Can
Take
you
the teeth out?
Yeah.
Yeah, it might be challenge, like in here.
We can do it afterwards.
But you're gonna close that. Yeah. Is there any way you can avoid that big tooth?
I'm trying. So I don't think I've hit it yet, but I can, I'm trying to do this, but not go all the way through.
It's just that he's an old.
15.
Yeah. There's going to be a lot of ankylosis, so it'll be challenging to do it in here.
Okay.
It would be easier if you were able to move into dentistry where we could do it in there.
Yep.
So also the challenge is once you close that lip, it's going to be, you won't have the same gape angle, so it's challenging to get in.
Yep.
So I'm thinking out loud right now, maybe
Well, maybe I'll just do this.
get it out, stop
I'll
the
get
bleeding, and then we'll
I'll
see.
get the node out, And then Sabrina, can we go over to dentistry? Yeah.
Once you get that out, I mean, it's not sterile. Can I poke around in there and see?
Afterwards?
Yeah.
Or now?
Once you get the mass out,
Yeah.
I'll just go get some elevators and see if I can't just lift those roots, because I think you're going to come down. You're below the alveolar margin on most of it, so it's just going to be roots.
Yeah.
Yeah, I'll go get some elevators. I might be able to do it just in here.
Okay, and I'll try and avoid that third
Then you
premolar.
can do your whole lip reconstruction at the same time, and it won't.
And if need be, we'll go to dentistry.
There's some dental elevators in the first floor. I don't know.
Yeah, I'm going to need some small ones.
Oh, okay.
I think those are bigger.
I'm trying to avoid that tooth, but I don't know whether I can because just the angle. Looks like I did. Okay, and so we've just done a little rim mandibulectomy. You can see here that if you've got a good enough view here that we've preserved this much of the cortex here. We've got the margins we want immediately. You can just take a picture just in there. Great, thanks. We're just speaking to Dr. Thatcher, who's a board-certified dentist, because he's going to be better than I am at removing those tooth roots. I do them sometimes, but this is an old dog, young, small breed dog, with greater potential to fracture the jaw getting those tooth roots out. So I'm less keen to do that, but as you can see here, that's pretty nice. We've got the margins we want, and got still a decent size of the cortex to maintain alignment and everything else. So happy with that. We'll just control that one little bleeder up there. And then we'll just wait for, oops, inside there.
Is that the inferior alveolar artery?
I don't think so, because that's in the canal itself. I think this is more, unless it's coming out, it may be where it comes out laterally. So we'll just basically close that to that. And we'll close here to here. So I'll just wait for.
Have you done this technique before with the saw or the oscillating?
The Mandibulectomy? Yeah. All yours.
Okay, well, I'll just put some gloves on and I'll see. You guys have size 10s in here?
Oh my goodness. We just last time.
You actually checked?
Same live stream.
You checked?
I was there.
You don't
So-
say have big hands.
So,
Big gloves.
so Dr. Thatcher is a resident joker as well. He's a HR representative, and I think he knows he's on live feed. You know you're on live feed.
Yeah.
Good.
Looks like you're able to avoid the 9.
Yeah, I think so. If that was, is that the third premolar?
That's
The fourth?
the first one.
Yeah.
over
So that's another difference between surgeons and dentists. Dentists actually know what the teeth
there. I'm just going to sneak
numbers are.
behind you if you don't mind. And here's. Look at that calculus.
I know.
Oh, yeah, that's what happens when they're old and ankylosed.
So even better that Graham's doing this, because he's saying that in older dogs the teeth get ankylosed and they're more difficult to remove. That's the
Pharyngeal pack. Yeah, a lot of it we can't even really see where tooth roots are. Partly because I don't want to call it thermal damage, but the saw
thermal damage.
causes some thermal damage.
So if you look at the other way,
There's 2 complete roots there. So that's mesial 8, distal 7.
If you were to leave tooth roots and the osteotomy sake, would you still run the same risk of abscessing or?
Well, that's a very, very good question. And I think we probably don't have the appropriate studies in veterinary medicine.
I don't actually see any other tooth roots along that margin. I think you probably got
One,
those
two.
ones.
I got these 2 here. There has to be a root in here. Maybe if we could just grab some. Hey, should be touching your. You just want to flush it for me.
Yeah.
I mean, it's a dirty field anyway, but. Theoretically, you have a higher risk of wound dehiscence. There's the apex of a root.
Nice.
See who's missing teeth already? Yeah, I don't think these are. I think that's it, and then there's one here I still have to get.
Okay.
The big one. Can you just flush that? That's good.
Do we have a leak?
Yeah, I think so.
I'm hearing a leak.
Oh, you,
The one thing I don't want to do is push it into the
good job.
mandibular canal. I can see it there. There's a study happening at Wisconsin right now looking at doing oral surgery without any periodontal treatment. Like that tooth right there. It's like, yeah, 0 attachment.
Yeah.
It'd be helpful to the animal just to, without 0 attachment.
Cool.
You're pushing on my breathing circuit and just tensing it a little bit. So you're aware.
I don't know where the. Sorry.
It's okay.
There's a little bit of root still left there, and I don't want to push it into the mandibular canal.
sorry, what were you saying about this study?
They're looking at a couple different things, just periodontal score, so periodontal health, and recovery from oral surgery, as well as radiation therapy. Just to look to see if there's a link between poor periodontal health and radioosteonecrosis. That's something that is known in human medicine. No one's really paid attention to it or looked at it. I should be pulling the apex of that root up, but it's not coming up. And I worry about pushing it into the mandibular canal, because I can see tooth root and I can't get it to move. The dentistry team at Saskatoon doing any groundbreaking research?
Not that I know of.
I don't think they have a research program at all.
They might start one up soon, I guess. Since they hired a new dentist.
Oh, did they?
Or I think they did. I'm pretty sure the resident stayed on his
Oh,
dentist.
okay, yeah. Is the resident done?
The one should be done, and then the other should be in second or third year.
Can I grab some 4.0 monocryl and 4.0 nylon, please?
Do you care about cutting your paper?
No.
You know Candace, eh?
Yeah, I know Candace quite well. So are you going to just do like a coloplasty where you're putting the lip to lip?
Not that far forward, but I will, basically yes. Like I'll,
Close the cheek.
and then, so I do it about there,
Okay.
I think.
Julius, I don't think I have that entire root. I can't tell though. I have these ones. I know I have those. It's just this root here. I can't be sure.
Well, so I'm going to be, I think in a 15-year-old dog, the chance of that being a problem is probably less than if you go digging for it and causing a problem.
I think we're at a stage where we should probably just.
Discretion is the better part of valor.
Well, flush it thoroughly and
Yeah.
ear closure. And what you'll see, and this is important, and it's an important theory, I haven't got proof, is where you've got a tooth right on the bone margin, that's where you're likely to have a problem. But if you have an alveolus and then there's a root down inside, you've got a blood clot there, and the blood clot is a perfect scaffold for new bone growth. The alveolar bone will grow over it and it'll all heal.
Right.
But if the root is right on the surface, you carry down ligament dual necrose, and then that'll be a sequestrum basically. So we know that happens when crowns are amputated, and that's the same thing as this. Amputation and so ideally, you get the roots.
Thanks for coming in and helping,
You're
Graham.
welcome.
Really appreciate it.
You're welcome. Have fun with that.
Just to ask you a couple questions.
Mm-hmm.
For Jade, for the calcitrol, how long is she gonna be on that?
Forever.
Forever. Okay. How long am I dispensing it for?
Forever. Maybe 2 months worth,
Okay.
but emphasize it as forever.
And then for this friend, you had, I believe, said no Medicam. Probably, I'm assuming he's on some liver stuff, I think. But he already gets Medicam today.
Yeah, I think it was because when I first saw him, he was on aspirin or something.
Oh, he was, that's true. Okay, so he's allowed to get Medicam.
Yeah.
For how long do you want?
Say for 10 days. 10 days.
And are you okay with him getting a Dexmed serum afterwards if he needs it?
Yeah.
That's already there?
For Jay's time to check like ionized calcium.
I'm just trying to work out how to close this, Matt. Oh, sorry.
Okay.
You look exactly like Matt.
Oh, yeah.
So
I
what?
want to add another body to the
What we did was, sorry, more questions?
Is he going to recovery or ICU? ICU. We're going to ICU? Is that
Okay.
okay?
Yep.
And then the only other thing is that he's on pregabalin, and we don't have that,
Okay.
but I assume that we, can we just switch it to gabalin?
Yeah, I think so.
And it's awesome that you can get a boarded dentist to come in and consult.
Yeah. No, it's so this dog had a lip squamous cell carcinoma, which we resected. It was adhered to the mandible. We were going to do a segmental mandibulectomy to get those margins, but we ended up doing what's called a rim mandibulectomy with a TPLA saw.
I was
So
looking for the mandible over there. I didn't see it. Oh,
So
look at that.
just to preserve that ventral cortex.
Do you have to plate it? How's the...
No, well, the ventral cortex maintains everything. Like, that's the strength and everything else.
Okay.
So I'm just figuring out how to close this right now.
Do you have to cauterize the bone or anything? Like, do you get a bunch of bleeding out of the...
Not usually.
Can you free it up ventrally or no?
I've freed it up. I'm just wondering, like, I can. That's the easy part. So I may as well just start there anyway. I want to cover that bone.
Oh, is this a stomy?
Cool, yeah. It's starting.
Just a stomy?
It's good to see things, even the TBLO, it's just good to see different ways things are done too.
But then do you anything else? No perineal root velocity or... I think it was the dog or was it the cat? I can't remember.
For the stutter?
Yeah.
No, it was a dog, a very, very small dog. But no, nothing rare. It was about suture strength, which I got right, and then about cystine stones, which I did not get right.
Yeah, I don't tend to quiz people. Maybe I'm bad that way. Do they quiz you?
Honestly, not as much as I'd like them to quiz me. I think it's a good way to...
You like to be quizzed?
It's just a good way
Get the tail out.
to reinforce your learning.
Yep.
Test where you should be at.
Yeah, that's
that
good.
type
I'll,
of thing, so.
I can learn
I'll
without
try and-
just watching, pretty aware of where my shortcomings still are. I'm the wrong person to ask now, sorry.
No worries, I didn't actually tell you that.
Oh, she didn't. I think she...
Oh,
Sorry,
typically.
I do know the answer to that, but not.
Why does she want some
She wanted me to mush up the bladder wall before we put it into the culture with mushed up stones. Also really impressed how efficient the hospital is. Flew through a lot of cases very quickly today.
One thing we try to work on. Now this is going to be. I'm going to stop there. I think that has to go to there somehow.
Also definitely the most men I've ever had in a nowhere.
How many guys are in your year?
There's 6.
Out of how many?
57.
Well, you don't have a girlfriend, you got good odds.
Yeah. We had 8 out of 88.
Oh, Jesus.
You had how many?
Sorry, not 8, 9. 9 out of 80.
Wow, it's amazing.
We used to do an annual golf guys in the different years poker night thing. It's just kind of funny, you know. That got shut down.
Why?
Politics and like Calgary vet school is just very weird.
Seems unfortunate.
Yeah. There wasn't a very good reason why it got shut down. It was just like some people feeling excluded and then COVID made it so that they didn't get like forced through.
Yeah. So the first bit was to cover the mandibulectomy site. It may have actually been nicer to include some of it in this closure here. Not be that bad.
What did Grant call it when he was saying you go lip to lip? Is there a special name for that?
Chelioplasty or chelioplasty.
Is the idea that they're gonna won't that they have reduced range of motion when they're opening their?
Yeah, if you do it too aggressively. I don't think this one's not going to be too aggressive. Should I do it this way? Just wait.
Just short?
No,
Oh,
take
you're
that out.
just
Yeah,
it out?
yeah. Do that one as well. This is not out. I'll just use monochrome for this, just so they don't need to take these particular sutures out.
Did you already do the memory masses?
Yes, yeah.
So I went back and looked. You were worried that it was going to be an inflammatory memory sarcoma before, and then you said that it wasn't in your notes. What made you change your mind after the physical?
Just seeing it. So memory ones, inflammatories are not usually a mass. They're more kind of just inflamed tissue.
Well, that seems obvious now.
These didn't look pretty, but they're still mass-like.
So make sure you don't leave without your Apple Pencil with you.
Oh yeah. I mean, you can borrow it until next week. It's okay.
I should be able to.
You want to the Apple
well,
Store or
maybe? Well, okay, if you don't mind.
No, it's
They're expensive.
I don't use the iPad that much, or at all actually. So you're welcome to borrow it while you're here.
Sounds good. I'll get another one over the weekend, or at least take mine in to have Apple look
Yeah,
at it.
that sounds good.
I don't have time tonight.
Did you take handwritten notes in school?
No.
Yeah, I tried. It was too slow.
Yeah. For tests and stuff like well, I guess that's partially like we have our slides in class, and I'll like annotate the slides.
Yeah.
But when I make like my study notes for exams, it's all on my computer. If I have the time writing it out, I always do better on the ones that I write out.
Yeah, that really reinforces.
But then I'll write it out on paper instead of on my computer. Computer is just kind of I just need to get enough to short term to pass the test.
Tissue here is always hard. If this dehisces, then it'll just heal by second intention, so I'm not too worried. But still, try and get as much of it closed as I can. So do that one long and that one shorter. And cover that with my well.
You know what we use that for pieces?
Yeah.
Yeah.
They're done. The last one is that fracture repair.
So it is going.
They were still undecided whether it was going or not.
Okay.
I think they were leaning towards it not going. At least
There's an abdominal mass, isn't there?
Sir?
There's an abdominal mass in the top.
Oh, I didn't hear. I know about that. Where it is?
There is.
8-year-old burner. Sounds about right.
See, what's the chances?
The abdominal mass, like a GI mass, or?
I can't see the CT report yet,
If you just open that up, like,
Yep.
say. Thanks.
and they said he got stat, but it's not, the report's not back yet.
Okay.
Okay.
Okay. Let's get that lymph node out. Thanks.
Don't forget the weird ear
Oh, thank you. Yes. Thank you very much.
Are you still playing this?
No. That's our lymph node there. Shall let's use that. Oops. Okay, same thing as last time. Let's see if we can find the other one. muscle again, so we'll stop there. So if you just want to close that, you can probably just do a buried subcuticular type of layer. I'm just going to go over and ink these, or ink this, and then I'll come back and take the ear one off once we're finished here. Oh, thank you. I forgot all about that dog.
I think I got the same roll you had. I didn't know I had to, like, I just brought it with me and tried to compare. And I also got the patches. The pads.
Yes, I don't know why they took the pads off.